Dear students, today's topic is soil transmitted helminths. Soil transmitted helminth infection are the intestinal worms affecting humans transmitted through contaminated soil. Ascaris, trichuris, and hookworm. These are the infections coming under the soil transmitted helminths. And worldwide, 1.5 billion people they are being involved, infected, and about 24% of the world's population are infected with soil transmitted helminth infection, especially tropical and subtropical areas are involved, with the largest number occurring in sub-Saharan Africa, America, China, and East Asia. Why they are grouped like soil transmitted helminths? Why it is grouped together? These soil transmitted helminth species are normally addressed as a group because they need similar diagnostic procedures and response to the same medicines. So it can be managed. So Ascaris, the route of transmission, fecal route. The infective form of the parasite is egg containing rhabditiform larvae. So these are the adult worms, female worm, and this is the male worm. After fertilization, two types of eggs are produced. The first egg, which is shown here, is an unfertilized egg, larger in size, cylindrical and mammillated coat is not pronounced, and fertilized egg is spherical or oval shape and having a pronounced mammillated coat. And this fertilized egg, when it goes into the soil under favorable condition, develops rhabditiform larva, and that is the infectious form of the parasite. Another parasite is a hookworm, which is one of the important leading cause of causing anemia, and the infection occurs by skin penetration. And this is the photograph showing adult worms. The morphology anterior part is showing hook-shaped structure, so therefore it is named as hookworm. So this is the egg of hookworm, which is a non-bile stained egg. The previous egg of Ascaris, bile stained egg. Now, third organism, that is a Trichuris trichura or whipworm. Morphology looks like whip, and the transmission is by fecal route. This is the characteristic morphology of the egg. The two mucus plugs at both poles of the egg, which is a cylindrical in shape. Now, what is the main cause? Like many other types of helminth infections, lack of sanitation, that is an important cause, especially in developing countries, in rural areas, that is there. Then practices of open defecation still followed in the rural areas, and lack of hygiene such as hand washing, walking barefoot on the contaminated soil, that is there, and it is regarded as one of the most important cause of intellectual and physical retardation. So intellectual and physical retardation, that was the reason. So high risk groups, preschool children, school age children, and women of childbearing age, pregnant women, and adults in certain high risk occupations like tea pickers or miners. And how is the clinical presentation? Infected children, there is a nutritional deficiency. Intellectually, there is a failure to progress in the school, and physically impaired and suffer from malabsorption of the nutrients, anemia, then diarrheal disease, dysentery, depending upon the what type of infection it is. Then there are effects of larval migration also. If there is a skin penetration, cutaneous larva migrans is presented. If there is a uh, penetration in the visceral organs, visceral larva migrans is developed. So why this is a like surprising thing? Why the Helminths are incriminated for the intellectual that lack of intellectual performance, or their decreasing in the school grades? Because there are various studies are available. Gut microbiota disturbance during Helminth infection, can it affect the cognition and behavior of children? So in this diagram, in this photograph, it is shown balanced gut microbiota maintains the axis gut brain axis, so and which results in the well-being. But if there is a dysbiosis, Dysbiosis, the change in the microbial pattern in the intestine. So it results into the stress, brain stress, and the balanced mechanism of gut microbiota and brain axis is disturbed. So gut microbial communities are necessary for the normal functioning of the this brain function also. So there is a balance between the gut microbiota and brain. So destruction of microbial communities lead to dysbiosis, and also the presence of helminth in the gut environment leads to down regulation of Th2 immune response. Host induced immune response is modified. Then there are products which are released by live worms. Nutritional deficiency is also accompanied, like vitamin A deficiency. Anemia is also there, and it is a well-known fact that if there is anemia, it leads to the various impairments, cognitive impairments, even social impairments, irritability. Then chronic pain in abdomen, that can be a simple reason, which is inability to concentrate on the studies. In addition to that, absent in the schools, that can be quite possible. So this is the reference from where this is information is taken. Periodic prophylactic measure to prevent high-risk people from one infestation. This is initiated by World Health Organization, and every year two dates are there: 10th February and 10th August. So this is called as National Deworming Day. And if the infection burden is more than 20% in particular locality, once in a year, it should be done in once in a year. If it is more than 50%, twice in a year, that about two dates, 10th February and 10th August. On that day, which drug is given? Single dose of albendazole 400 milligram is given for all children age 1 to 19 years. Elimination. WHO aimed to eliminate morbidity due to the soil transmitted helminth infection in children by 2030. The global target is kept below 2% of children, and this should be the target here is given as 2030. There are some questions the students can remember. Some short questions, 3 marks questions are asked, or even it can be modified in the form of MCQs. Use examples of the parasites infect by skin penetration. So active skin penetration by hookworm. Both the species, Ankylostoma duodenale, Indicator americans. The infective form of the parasite is filariform larva. Then Strongyloides stercoralis, filariform larva is again. And next is a Schistosoma hematubium, where the infection occurs by cercaril penetration. Another question is, give examples of the parasites which enter by skin penetration through the bite of insect vector. Plasmodium, all of you know that. Female Anopheles mosquito is there. Leishmania, phlebotomine sandflies, these are the vectors. Wuchereria bancrofti, Culex, majority of the vector, 99% in India. Then Brugia malai, Mansonia, Anopheles, Aedes mosquito. Loa loa, deer flies, these are the vectors of transmission. Onchocerca black fly similium. Trypanosoma fly or Glossina species. Babesia, exotic ticks. So these are the vectors of transmission various diseases. So question may be asked in exam. Thank you for your patient listening. So all of you prepare the notes about this particular topic. It may be asked. Thank you.